After 35 years, I've seen plenty of people with joint injuries or health issues have to wait weeks or even months for medical appointments and feel like they can't do anything to help themselves in the meantime. I'm going to show you 3 safe exercises that you can start doing right now to keep your independence so more weakness doesn't set in. You will have the ability to build new strength because waiting to get fixed becomes a lot harder to come back from, regardless of what your specialist can do to help you. For a lot of people after 50, especially women, the wait is where the real trouble begins. Because if you have pain in your hip or your knee or your shoulder, too often the system looks at your age before it looks at your ability. It pushes medication, it pushes joint replacement, it lectures you to just slow down and be careful. But it doesn't always look hard enough at the things outside the pain. The bursa, the tendons, the muscles, the compensation patterns. The weakness that built up while you were trying not to make it worse. I'm going to show you why waiting for medical help after 50 can slowly make your body worse before you ever get treatment. Because your body does not pause while you wait, it adapts. And sometimes it adapts in the wrong direction. You move less because it hurts. You get weaker because you move less. Then the weakness creates more stress on the very joints that already hurt. That's how people slide into decline without really realizing it, not because they're lazy, not because they don't care. It's because they're still just waiting for that appointment. And here's the part that most people don't think about. Let's not get into resentment mindset here, okay? The medical system isn't failing you on purpose. They're working inside a system that is stretched thin. They're doing the best they can. I've seen this myself. I've worked in physical therapy for 10 years out of college, and I see it today. The medical industry has just gotten more challenged to meet the needs of the public. It takes longer now to get help because the population has aged and there's just more of us. I get that. I've seen that, and I've had to work with that. There were times where I was working with a stroke patient, a cerebral palsy patient, a joint replacement patient, and a frozen shoulder patient all at the same time. But that's what's helped me build my expertise. And it's also the type of thing the medical industry is having to try and support right now. But a lot of people fall through the cracks when it comes to immediate, affordable, thorough healthcare. So no, I don't think it's crazy that people go online looking for answers when they can't get access to the help they need. The danger is not in wanting help. The danger is in having no plan while your body quietly just gives things up. But here's the surprising part. The wait doesn't have to mean decline. While you're waiting, you can start getting stronger in the ways you still can. You may not be able to control how long the appointment takes, but you can control whether your body gets weaker while you wait. Now, let me say something that may sound bold, but I believe it's true. In many ways, a person's fitness instructor, personal trainer, or strength coach is one of the first lines of their health care. Not a first responder in an emergency sense. I'm not saying that. But who sees people 2 or 3 hours a week, every week, and watches how they move, how they feel, how they compensate, how they carry stress, how they perform? We do. We're qualified to instruct exercise, but if we're paying attention, we're also managing what their body is telling us that day. Stress, energy, pain, mental strain, soft tissue problems, early movement changes that tell you something is off before it becomes a real problem. I've been seeing this up close for over 35 years. Those first 10 years were spent working as the strength training instructor in a private physical therapy practice. And now in my own fitness facility, I'm Coach Rudy. I'm the use it, not lose it coach. And just when I thought I'd seen everything working in physical therapy, I kept seeing the same pattern repeat itself. I watched patients trying to get in with aches and pains, working within limited visits and limited care, and we always tried to give them the best help we could. I watched the physical therapists I work with fight to make sure every single person got the care they needed. And that taught me something important. People didn't just need help inside therapy, they needed a way to keep getting stronger outside of it too. That's where my whole integrated fitness program started. I wanted people to have another option, another path, another way to keep building strength instead of just waiting and losing ground. The practice I came from was almost like a last chance program. A lot of people had already exhausted hospital stays, they had exhausted their insurance treatments, they had chronic injuries, chronic pain, chronic health issues, and they came to us because the practice specialized in thinking outside the box. Long-term care, chronic soft tissue injury, aches and pains, joint replacements, basically a lot of the things that people experience after 50. Let's talk about what really happens when pain after 50 gets left alone too long. It doesn't just hurt, it starts turning movement into disuse and disuse into decline. The body starts protecting the painful area, then everything around it starts doing less. Muscles weaken or simply get very tight because they're trying to protect that area. So the range of motion shrinks. Then your confidence drops, and then one painful joint turns into a whole body problem. Now, here's where most people go wrong. They wait, they protect, they stop moving, and the body just keeps giving things up. The same basic principle we used in physical therapy was this: get the surrounding muscles stronger, get the surrounding areas more mobile, more flexible, and improve range of motion where you safely can. I'm not saying I can fix a damaged soft tissue injury. What I'm saying is this: let's build strength around the surrounding area safely and just see if that can help, or at least stabilize it until you get the medical attention you need. Now, if any attempt to get stronger simply irritates it, by all means, back off. Now is not the time to try and do anything on your own. You're welcome to continue watching this video for information purposes only, but if you're not clear to engage in any form of vigorous, high-intensity exercise, then I'm not recommending that you do anything I'll be suggesting in the rest of this video. So one joint isn't taking a load that causes more deterioration, so function stays alive, because in midlife, this is the use it or lose it time of life. And if you let pain turn into total inactivity, you don't just wait for help, you help the decline speed up. If pain is pushing you toward disuse, that's the moment to interrupt the pattern. Not with panic, with strength, movement, and a real path forward. Slowing down is not a solution. Slowing down is just a slower version of the same problem. That is why my programs exist. I have a Strength to Heal program that helps people gently create an exercise environment where they can start getting stronger while working around old joint pain and soft tissue injury. And from there, if they're capable, they can move into my main resource, my Pivot to Strength program. That's where the shift really happens. Not just trying to survive pain, but building enough strength that old injuries stop running the whole story. Because honestly, this is never mainly about aging. The only part about aging I really point out is the speed. It just takes longer to build strength, and it takes longer to recover. But outside of that, so much of what people blame on age is really disuse. Pain, uncertainty, fear, just not knowing what path to take. And I haven't even told you the best part yet. Because the exercises I'm about to show you don't require a gym, heavy equipment, or a perfect body to start. Today, I want to give you 3 exercises that show you the kind of thing you can do to start maintaining long-term health. Today, I'm taking you inside the kind of strength work I use with women in their 50s and beyond, because this is not the decade to slow down. This is the decade where strength starts to decide everything. Before I show you the exercises, I want you to understand something. The people demonstrating these are not hired fitness models. These are my clients. These are sister lifters. These are real women in the age group we're talking about. And that matters because too many people over 50 are shown fitness that just doesn't look anything like their real life. Here's my client, Mary Jo. She came to me right before retirement. She started with some of the basics, slow and steady, and she's doing great. People love to say your 50s are the time to slow down. I don't buy that. I don't buy it. This is not the decade to fade out. This is the decade where strength matters more than ever. You may be planning retirement. You may still be helping adult kids. You may be helping with grandchildren. You may be carrying the emotional and physical weight of aging parents. Here's a perspective most people don't think about. Your body doesn't know you're planning to slow down. It only knows whether you're using it or not. This is not the decade to fade out. This is the decade to get stronger because strength is what protects everything else. If life is asking more from you right now, then your body needs more support, not less. That's why getting stronger matters. Mary Jo came in with a lot of the same concerns so many people have. She needed balanced exercise, functional strength, something sustainable. Not punishment, not ego lifting, not some workout that ignored the body she actually lives in. So let's get into the first exercise. I'm going to show you one of the simplest strength moves I use to help women over 50 start strengthening and improving the flexibility of the back of their body and building support at the same time without needing heavy weights or fancy equipment. The first exercise is a simple straight leg deadlift pattern. Light, controlled, no heavy weights needed. The goal here is not to show off. The goal is to stretch and strengthen the back of the legs in a safe, practical way. When Mary Jo bends over, she's getting length through the back of the legs, the hamstrings and calves. And here's something I wasn't expecting when I first started using this with older clients: how much those muscles affect everything else. They influence tension in the low back, tension around the back of the knees, posture, and hip function too. Then when she comes back up, she pulls her shoulders back and keeps a nice straight spine. So now the exercise is helping hips, back, knees, and posture at the same time. That's what I mean by useful exercise. One movement, multiple benefits. And if you have low back issues, limit the range. That's what Georgie does. She's one of my assistants and she's had major back surgery, bolts in her back for spinal stabilization. She still uses the pattern, but only in the range she can safely control. I say this to my clients all the time. Comparison is the thief of joy. You do what you can, you get stronger at your own speed. Careful is a start, but careful without stronger is not a plan. Start where you can, own the range you have, and then build from there. That's how strength actually begins. Not every exercise has to look big to be effective. Not every person should move through the same range. And not every limitation means stop. Okay? Sometimes it means adjust. Now let's go to the second exercise. Let's bust one of the biggest mistakes people make with knee pain after 50. It's not always your knee failing. Sometimes it's that your hips stop doing their job. And this next exercise starts fixing that. The second exercise is the chair squat. And for a lot of people, this is one of the safest and most important movements they can learn, especially if they haven't worked out with weights or haven't been moving much. You sit mainly on the edge of a chair and stand up. That's it. Now you can use dumbbells, you can use water bottles, or just body weight. But here's the catch. The real point is not how much weight you use, it's where the force goes. Press through your heels as you get up. Push the hips forward. Don't dump everything into your knees. That's the trap, especially for people who sit a lot. They stop using the hips, and the knees just pay the price. So when you stand, use the strong muscles in the hips. Let them do the job. That's how you start reducing wear on the knees while building a stronger lower body. Then when you're ready, you progress by adding some resistance, just like Mary Jo does here. But the win is not the dumbbell. The win is learning to move with the right muscles. The goal is not just to protect your knees. The goal is to build enough strength that your whole lower body starts working the way it should again. If you've been trying to move carefully, good. Now add strength to that, because careful without stronger is just not enough. And that's a bigger principle than just squats. A lot of pain problems get worse because the body starts handing work to the wrong places. Knees doing the hips job, low back doing the core's job, neck doing the shoulders job. Once you see that pattern, everything starts making more sense. Now for the third exercise. I'm going to show you a small shoulder exercise that does a lot more than people think. Because when posture starts collapsing after 50, it's usually not just about aging, it's about strength and motion quietly leaking away. The third exercise is for posture and shoulder range of motion. It's a palm up shoulder rotation. This is not about throwing heavy weight around. It's a finesse exercise. You might be able to lift more on the chair squat or the deadlift pattern, but this one is about building strength while maintaining motion. You bring the dumbbells up and out, then turn the thumbs down like you're pouring water out of a pitcher. That pattern helps keep shoulder range of motion alive. It helps build strength in a safe way. It also encourages extension through the spine, which helps posture. This is one of the warm-up exercises I love using, and for people dealing with shoulder rehabilitation, it helps a lot. It's controlled, it's practical, and it reminds people that exercise does not have to be dramatic to be effective. Here's the one thing no one tells you. A lot of what people call aging is really just strength and motion slipping away quietly, and that means you can start getting some of it back. This is why the answer isn't just slow down. The answer is to keep building strength and motion before your body gives more away. And I haven't even told you the best part yet. The stuff that makes all three of these exercises matter even more than the movement itself. Now, let me say the part that changes the entire meaning of this video. This is where the story pivots. The deeper point is this: waiting for medical help is not the only struggle. The bigger struggle is what pain makes you believe about yourself while you wait. It makes people think they're fragile. It makes people think they should stop trusting their own movement. It makes people think their body is permanently headed downhill. It makes people think they've become the kind of person who can only be careful now. There's an important lesson here, and it has nothing to do with exercise. It has to do with what you decide to believe about yourself while you're waiting. Let's talk about the biggest myth people start believing after 50, that pain means you're fragile. You're not fragile. I'm going to say fragile a lot of times because that's what you're not. And I want to show you what strength actually looks like when you stop treating yourself like you're breakable. You're not fragile. That may be the most important thing I say in this whole video. You are not fragile. You can get stronger. Now, some of you may lift 10, 15, or 20 pounds within the first 3 months of strength training. Some of you may need to stay with 3 pounds or 5 pounds because of joint injury. That is fine. Strength is still strength. Progress is still progress. And comparison is still the thief of joy. The goal is not to prove something. The goal is to rebuild function. The goal is to create a body that supports your life instead of limiting it. So if something hurts, maybe you shorten the range. Maybe you use less weight. Maybe you're not ready for that move yet. And that's okay. But none of that means you're done. It means you need the right path. You're not fragile. You may need a better plan, better coaching, and a better progression. But you are not done. The solution is not to treat yourself like you're breakable. The solution is to start building strength that gives your life back, gives you more options. And yes, obviously, if you have chronic issues like arthritis that limit your range of motion, you should be cleared by your medical professionals before you engage in any exercise. Always keep that in mind. But these are simple movements you can try within safe limits. And if you feel pain, that tells you something. Maybe you're not ready. Maybe the range is too big. Maybe the weight is too heavy. A lot of this can be done with just body weight. That is plenty for many people starting out. So let's step back and see the whole picture. So the setup is simple. People know they have to be cautious about information they learn on the internet. We all know that. But the dilemma is real. They're hurting, but they have to wait for the medical appointment. They can't get fast, affordable, specialized help, and their whole body starts declining more while they wait. The twist is this: the real danger was never just the delay in medical care. The real danger was letting the delay convince you to stop using your whole body, to stop building strength, to stop fighting for function. That's where the decline becomes sneaky, and that's where we have to interrupt it. So, what do you do now? You do not panic. You do not assume every pain means you're falling apart. You do not wait passively while your strength disappears. You start where you can, you move in a reasonable way, you build the surrounding muscles, you improve mobility where it makes sense. You protect function, you respect your limitations, but you do not surrender to them. If you've been waiting for a clear path, this is the part that matters, because you do not need more random advice after 50. You need a way to start getting stronger that actually fits the body that you have right now. That's what my programs are built for. Strength to Heal helps you begin gently. Pivot to Strength helps you move into real strength when you're capable. And if you want to learn more about the next step, click the link in the description. You'll be able to learn more about the program and what path may fit you best, because you do not need more confusion, you need direction. Do not confuse slowing down with solving the problem. Those are not the same thing. You do not need more confusion. You need a path that helps you get stronger, because stronger is the strategy now. So, thank you for watching. Go ahead, click the link in the description if you want to learn more about the program itself. And check out this next video too, because I'll help you better understand what you're still capable of doing. Not someday, now.